If someone has digestive issues, but taking HCL gives them acid reflux, does that mean they don't have low stomach acid? It depends. So, I mean, ideally, you should be eating protein and fat with that meal. So, you're taking it in. So, you have something to neutralize the acid. Ideally, you're taking that first. So, let's say you have a low level gastritis. We don't want that stomach acid hitting raw mucosa and creating irritation or inflammation. So, ideally, protein and fat, that's in there first. Stomach acid comes in afterwards, and you start at a very, very low dose and you work your way up. Again, if you have a history of ulcers or gastritis or just stomach inflammation, I always recommend starting low and then working our way up. If you just kind of came in at a random high dose and you have a history of questionable stuff, then my recommendation is you go backwards, get your diet dialed in, get the timing of your hydrochloric acid in there, maybe do some healing, soothing things on the gut lining if you know you have that history, and then work up slowly. Again, if you come in there and you just throw things around and you don't get the dose dialed in or you don't do it in the right way, you can create a lot of contradicting symptoms and that can confuse you. And then you're like, oh, what's my next step? Right. And, the benefit of working with someone like myself is I've kind of seen all that stuff hundreds of times. And so I always try to bring patients to a solid plateau. So when we work off that, we can mitigate all of these potential side effects. Great question, though. Can high cholesterol cause joint pain, inflammation sometimes? No. High cholesterol is always an effect, not a cause, right? So cholesterol is a building block to all of your hormones. Almost all of your hormones are cholesterol based, right? There are some that are peptide based. I want to say like insulin and growth hormone are peptide based hormones. The rest are steroid. Just like which hormones are peptide based? I want to say it's insulin and growth hormone. So yeah, angiotensin, cholecystokinin. These are more like signalers. They aren't hormones. Like I put like cortisol a hormone, insulin a hormone, growth hormone. Yeah, 3 examples of peptide. Yep, prolactin, HGH, and insulin. So I was right. Good. Insulin and growth hormone are the 2 big ones, and then all the rest mainly are going to be your steroid, which hormones are cholesterol based. And that's going to be like your cortisol. Yep. That's going to be your estrogen. That's going to be your progesterone. That's going to be your testosterone, all those main hormones that we're talking about. Yep. So, in regards to that, if your cholesterol goes up, it's usually responding to something inflammatory in the vasculature. It could be eating junky foods, processed sugar. High levels of sugar and insulin can cause glycation. That can create oxidative stress. It could just be you did a really hard workout and you have muscle breakdown and you have tissue breakdown and it's trying to heal it. Could be like a car accident, like an injury. All those things would be the cause. And then the cholesterol is responding because it's a building block of these different hormones, especially cortisol, which is anti-inflammatory. Cortisol is your natural cortisone, if you will, and that's trying to kind of calm down the inflammation that may have caused. So, yeah, it's really important to look at things from a causal nature. Cholesterol is always the effect, not necessarily the cause.